Process is underway that could change where people in the Tri-Cities go to receive medical care for the most serious emergency traumas.
And the merger of the two health systems means Ballad Health system has two level 1 trauma centers. One in Johnson City at the Johnson City Medical Center, the other at Holston Valley Medical Center in Kingsport. Bristol Regional Medical Center's trauma center is considered level 2.
There are only 6 of those most advanced level 1 trauma centers statewide, with most metro areas having only 1 each. Jordan Moore found out whether those 2 trauma centers should be consolidated into one is a big question for the new healthcare system.
Well, Josh, there, is actually former Kingsport Mayor Dennis Phillips that wanted to know whose decision it will be if the Tri-Cities 2 level 1 region trauma centers will be consolidated and when. That question revealed some new information about where this process stands. It's been a question since the merger was just an idea. Will our region lose one of its level 1 trauma centers? Something we first reported back in 2016 when the 2,000+ pages of the Certificate of Public Advantage document became public, saying they are, quote, expensive to maintain and redundant in a region with a low population density. Now, in late 2018,
and at what point is that a management decision, regardless of where the heart center is located, the trauma center is located, there's going to be upset people.
Even the former mayor of Kingsport wants to know. Dennis Phillips is a member of the COPA Local Advisory Council, which met Thursday night, a liaison between the public and the state as it oversees the Ballad merger.
The system has to go through a process to determine whether and how to consolidate trauma services.
Interim COPA compliance officer for Ballad Health, Gary Miller, says the decision has not been made.
So it's an odd situation, but it's one that has taken hold in the public mind, and so something has to be studied pretty thoroughly. It's a question of whether you can better spend the resources, not duplicating that level 1 trauma on other things.
And even if the health system consolidates into a single level 1 trauma center, Ballad almost certainly would maintain fully staffed and equipped ERs at all of its flagship hospitals. It would just mean that one of its hospitals would have the most complete emergency care options, such as 24-hour trauma care and coverage by other specialties. Live in Johnson City, Jordan Moore, News Channel 11 in your corner.
And we found out the Ballad Board of Directors will meet in the next few weeks and trauma centers will be on the agenda, but that doesn't necessarily mean any decision will be made at that time.